Myocardial infarction in emergency. Mr. Laroka, 51 years, presents in surgery with severe chest pain for the last 10 minutes. Please get the data and manage proceed. Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm, am I talking with Mr. Laroka? Nice to meet you, Mr. Laroka. May I know what brings you to the clinic today? Okay. Tell me more. Is there anything else you want to share with me today? I'm very sorry to hear about that, Mr. Laroka, and I totally understand that how painful situation would be for you. But in order to better understand your condition and reach my diagnosis, I would like to ask you a few questions. But as you are in severe pain, may I offer you some painkiller before we proceed? How it sounds to you? Are you sure, Mr. Laroka? Thanks for your cooperation, Mr. Laroka. So can you tell me since when you're having this pain? About 10 minutes, okay. And what were you doing when pain started? Okay. You used to carry grocery on weekends? Okay. If you experience such pain in past as well? Okay. Can you relocate? Where is the pain exactly? Okay, it is in the center and left side of chest. Okay, Mr. Laroka, is it constant or come and goes? Okay, and how severe is the pain on the scale 0 to 10? As 0 is minimum and 10 being maximum. It's around 7. Okay, Mr. Laroka, does it go anywhere else up or down? Okay, it goes to your left arm up to little finger and neck and jaw. Okay, if you had any medication to relieve the pain? Okay. So what do you think, what aggravates the pain? Okay, if there is any associated feature along with pain, like a nausea, vomiting. Okay, if you notice any sweating, profuse sweating. Okay. All right, Mr. Laroka, have you gone through any investigation so far? Okay, ECG. And can you please show me the ECG? Mr. Laroka, 60 years old, and Infarction. Well, Mr. Laroka, I'm a little concerned about your condition. May I ask you a few more questions quickly if you allow me? Thanks for your cooperation. Mr. Laroka, can you pinpoint this pain with one finger? Okay, it's all over. Is it related to movement? Did you have any chest pain with increasing breathlessness? Okay, and do you have any fever? Any cough? Any blood in the sputum? All right, Mr. Laroka, did you travel for more than 5 hours recently? Okay, have you noticed any rash on your left side of chest? Okay. If any family member has rash, which is very painful. All right, Mr. Laroka, I would like to ask you a few personal questions to better understand. Is that okay with you? Thanks for your cooperation, Mr. Laroka. So, do you smoke? How many cigarettes per day? And since how long you have been smoking? Have you ever tried to quit this habit? I really appreciate that, Mr. Laroka, and we will talk in detail in next appointment. How it sounds to you? Okay. And do you drink alcohol? Okay. Do you have some heart problem running in your family? I'm very sorry to hear about your father, Mr. Laroka, and I totally understand that losing a parent is very painful. May I know the age of your father when he died of heart attack? Okay. And do you have high blood sugar? High blood pressure. What do you do for a living, Mr. Laraka? How are things at workplace? Okay, and how are things at home? If you are married, do you have children? Okay, and all right. And how about your mood? Okay, what kind of weather do you like the most? And how about your sleep, Mr. Laraka? Well, Mr. Laraka, your ECG shows certain changes, which could be as serious as heart attack. And for that reason, I would like to offer you admission in cardiology in emergency. Is that okay with you? Do you agree? I appreciate your concerns, Mr. Laraka, but at this time, if I were in your condition, I would have admitted myself in emergency. Okay, and if you were my brother, I would have given you the same advice. Because it is my considered opinion as your doctor that it is better to get yourself admitted in emergency and visit your doctor once you have recovered. Is that okay with you? Yes, Mr. Laraka. Otherwise, your family members will be worried as well. Okay, and a situation would be totally, difficult. God forbid if you will have any, problem while flying or at home. Okay, so that's my considered opinion. How it sounds to you, Mr. Laraka? I really appreciate that, Mr. Laraka. So, is there anybody accompanying you at the moment? How you come to the clinic? Okay, using Uber. Okay. All right, Mr. Laraka. So, would you like me to inform your family? Okay, you need not to be worried. I'm going to inform your family. Okay, and I'm calling ambulance right away now. While ambulance is on its way, I offer some painkiller injection like morphine, 2.5 mg in muscle, okay, along with injection metoclopramide 10 mg, okay. This will relieve your pain and nausea. Is that okay with you? And along with that, Mr. Laraka, I'm going to offer 2 tablets of dispersible aspirin, 300 mg in a glass of water, okay. This will help to dissolve the clot in your blood vessel, okay. And I'm offering you 100% oxygen as pulse oximetry shows your oxygen saturation less than 92%, okay. You need not to be worried, Mr. Laraka, okay. And I would like to establish IV line, okay, and offer to take some blood sample for cardiac enzymes, troponin T and I, and blood complete picture, urea, electrolytes, and creatinine. Okay, this will save some time in emergency. Okay. Yes, Mr. Laraka, you need not to be worried. I will get written record of all the medicine given at surgery in order to avoid duplication in emergency. Okay, and I am going to inform emergency, okay, that you will arrive there, okay, so that you don't have to wait. How it sounds to you, Mr. Laraka? Yes, Mr. Laraka, in emergency they will try to dissolve the clot with some medicine in drip, which is blocking your heart blood supply, okay. And let me assure you that emergency facility is only 20 minutes away, okay. And staff in ambulance will be there, okay, with you, okay. So you need not to be worried. Is that okay with you? Is there anything else you want to discuss with me today now? Yes, Mr. Laraka, I will continue to take care of you once you are recovered from your heart attack, okay. And then we'll talk in detail about some lifestyle modifications, okay. You can count me in your supporting group as well, okay. Is there anything else you want to discuss? All right, Mr. Laraka, I wish you a speedy recovery and healthy life. Take good care of yourself. Bye-bye.